Advocacy. Advocacy is speaking up for or on behalf of oneself or others. And this is a very important role for health professionals in educating and influencing politicians, community leaders and those in decision-making positions. Advocacy activities are not necessarily health promotion programs as such, and so a lot of advocacy activity will be undocumented. So I've just given some examples of advocacy activities that could be undertaken by anybody working in oral health promotion. Support for water fluoridation, and this takes place through communication with members of Parliament, newspapers and other media. Providing information on milk fluoridation at a local level, so working with head teachers, school governors and parents to encourage the introduction of a milk fluoridation scheme in school would be an advocacy activity. And any dental health input into food policy, say working with a local authority where an infant feeding policy may be designed, a school meals contract being negotiated. So the role of the health professional here, dental health professional here, in advocating on behalf of oral health is really important. And as you can see, wouldn't necessarily be seen as a health promotion programme. Health promotion works in partnership with a range of agencies, as dentists on their own can't be expected to achieve results. The challenge is to bring oral health into the broader public health agenda and form effective partners with influential groups and organisations through intersectoral working. And presented a list there from Watt and Fuller of the various partners with whom we might work. Health professionals can be doctors, community health workers, pharmacists, child health nurses. In education, there are obviously teachers, head teachers, support staff in school, but also education planners. In local government, we have our local politicians, as well as education departments and planning departments, catering services. In the voluntary sector, there are community groups and faith groups. Industry and commerce, working much more upstream here, we'd be thinking of the water industry, food retailers, drug companies, and food manufacturers and advertisers. And at national government level, politician and then departments of education, trade, agriculture. The common risk factor approach I'm sure you're familiar with. So the risk factors for oral disease are also risk factors for other chronic diseases, and so a holistic approach makes complete sense. Oral health interventions in isolation can be wasteful in terms of duplicating services, but also we may be providing contradictory messages which would be confusing for the public. National and local initiatives in preventing life-threatening diseases can be an ideal opportunity for multi-sectoral working with those partners as we've described above.